The Presidential Task Force on Covid-19 has expressed concerns over the capacity of the healthcare infrastructure in Nigeria to meet the growing number of new Covid-19 infections as the country battles a second wave of the pandemic. The PTF chairman, Boss Mustapha, who made this known at one of the briefings, also hinted that medical personnel are equally overwhelmed by the severity of the cases and may be left to make critical decisions.
57 lives were lost from COVID-19 related issues in the past week in Nigeria. This is the highest weekly fatality recorded since the infection became endemic in the country. This fact, coupled with the lack of medical capacity to cater for the overwhelming new cases, the PTF says is working on new measures to avert the worst.
On this particular trajectory, we will soon be overwhelmed. There's a conscious decision now. Every medical officer or clinician has to make as to prioritizing those that are likely to live, to be brought into care or allowed to die. I think for medical doctors, that's one of the most difficult decisions you can ever take. I don't want us to get there, but right now we are gradually niching towards that. My appeal, Commissioner Health Cross Rivers, you are the chairman of the Forum of Commissioners of Health. Tell your people to open up the isolation centers and begin to test.
Majority of the states, I think about 34 states, got support from the PTF in October of last year. Each of the states got 1 billion naira each from the federal government of Nigeria, and we're very grateful for that support. It helped a lot of states with surveillance and to ramp up testing. However, for Cross River State, of course, this money came quite early in October, and we had bought in a lot of things, PPEs, several things which we needed, some of which were now affected during the vandalization, looting that followed the NSAS protests. But going forward, a lot of support is still needed by state government.
The chairman of the task force gives account on how another 13 members of his family contracted the virus less than a week after 9 of his immediate household recovered from the disease.
To my greatest shock, 25 were tested. I got a stunning call from the the medical director of the Federal Medical Center, Yola, asking me not to come home. And I said, why? He said, I'm shutting down your house. I said, what for? He said, out of the 25 samples we took on the 23rd, 13 came back positive, including your cook.
There seemed to be hope inside, as Nigeria, through the COVAX facility, is expected to receive 100,000 doses of the Pfizer-BioNTech COVID-19 vaccine by the end of January and 42 million doses in the second phase. Oyedia Orum, AIT News, Abuja.